Tell you what exactly is going to happen. Are they going to get rid of Medicare? One thing that we have with the states that other states don't have, we realize that in the future, if they were to take Medicaid, asset protection, or partnership policies away, we have put in something in place to protect the individuals who already have been promised Medicaid asset protection, so that you would have the Medicaid asset protection paid through your policy. So there are some provisions to help partnership policyholders. If Medicare goes away, that is huge. And what impact is that going to have on everybody? It is very hard to say. We don't think it's going to happen, but who knows, right? Yes?
Regarding asset protection, can you get a policy for X number of dollars of protection and then at some point change it, either adding or subtracting, and there's that point you have to get another policy, you have to rewrite the policy?
Okay, so if you buy a policy and then you want to add on more to it, do you have to buy another policy? In general, if you buy $300,000, for example, for a lifetime benefit under the partnership, it's up to the insurance company if they will allow you to increase with underwriting. Automatically, your policy is increasing by 5% compounded because of the inflation protection. In most instances, then you would have to buy a separate policy, and the separate policy cannot be any lower than the 213 or whatever the amount is at the time. And so in some instances, people may start off with a partnership policy if they feel they need more and they cannot buy the minimum required through the partnership, then you would buy a non-partnership policy. So you could have a combination of both. Now, anytime you have a non-partnership and partnership policy, the non-partnership policy will always have to pay first, and anything extra will be coming out through the partnership policy. So ideally, it would be better to buy higher coverage from the start instead of trying to change it later if you can avoid doing that. Yes?
You're not a government agency, is that right?
I am with the...
I mean, the partnership is a private agency, it's not a government.
Okay, is the partnership a private agency? So just to clarify, back in 1990, close to that, the Robert Wood Johnson Foundation was providing grants to those states that develop partnership programs, and Connecticut was one of the first. So the partnership is really a partnership between the state, the insurance company, and initially the Robert Wood Johnson Foundation. So although we oversee through the insurance department the insurance companies, they got to meet our requirements, then they pay their claims, whether they're making profits or loss, that's all by the insurance company. So we're partners through the fact that they got to meet our requirements, and we oversee transactions.
There's something in the Affordable Care Act that says states have to set up an exchange to help to select insurance companies. Aren't you similar to that idea of exchange?
Okay, so the exchange, the health exchange, is something new that some states are trying to be up and running as quickly as they can. And through the exchange, when the healthcare reform was introduced, there was